Jenna. I'm going to be your nurse today. May I have your name, your full legal name and date of birth, please? Okay. Let's get my place on here. Alright, I'm just going to take a look at your wristband just to confirm. Okay, name and date of birth match. Any allergies? I see that you have a latex allergy right here. These are non-latex gloves. Okay, no other allergies. Perfect. So today I'm going to do a cardiac assessment on you just to make sure, that I'm going to listen to your heart and look at your blood vessels in your neck and then check your extremities for perfusion and all of that. So do you have any questions before we get started? No? Okay. So I'm currently assessing for color and just general appearance. The patient does not look like they're in distress. Their color looks normal, so that's great. So now the patient's at a 45-degree angle, so I'm looking at the neck. I'm assessing for jugular vein distension, and it all looks good. No abnormalities there. They're not distended. So now, I'm going to palpate the carotid arteries one at a time. And I can detect a pulse, and it seems strong. So now, with the bellow of my stethoscope, I'm going to auscultate the carotids for bruits.
So why do we have to do all of that then?
Okay, and no bruise. So now, sir, I'm going to lower your gown so I can examine your chest. So I'm just looking at the chest. I don't see any abnormal pulsations. The heart's not beating out of its chest or anything. So now I'm going to palpate the apical pulse. I can feel it, it feels good. So now I'm going to just palpate for thrills and heaves. And I don't feel any, so that's great. Now I'm just going to take a listen, first with my diaphragm, then with my bell in the 5 positions. For a couple beats each. Turn of the bell. Okay, it all sounds good. I'm going to cover you up, sir. Okay, so I'm just going to check extremities. I'm going to check the radial pulses bilaterally. They both feel equal and strong. I'm going to check cap refill. Looks good. All right. Now I'm just going to raise the blanket to expose your legs so I can look for, I'm looking at color. And the skin color appears normal, no redness or blue, cyanosis. So now I'm just going to palpate for edema. And I don't feel any edema. So now I'm going to palpate the dorsal pedis pulses. And they feel equal and strong. I'm going to palpate the posterior tibial pulses. And they feel equal and strong. Okay, sir, well that concludes the assessment. Are you having any pain right now? No? Do you have any questions for me before I get out of here? No? Okay. I'm going to lower the bed. I would lower the bed, I'm not going to because my friend has to go next. So the bed is low and locked, 2 guardrails up, call light within reach, questions answered, pain assessed, no concerns, room free of clutter.